We welcome our viewers all around the world. In this video documentary, we will focus on health in the United Kingdom, and in particular the National Health Service. As is typical of all our video documentaries, we will go into the details of this important healthcare sector. We thank our United Kingdom healthcare contributors for providing the information contained in this video documentary.
This video documentary will explore the history and objectives of the NHS, its funding, significant milestones, history of firsts, and its current challenges. We'll hear from doctors, nurses, and other healthcare workers about their experiences. The documentary will also cover governmental efforts to improve pay for these workers to prevent attrition. Additionally, it will present views from both Labour and Conservative parties on NHS issues like privatization, and discuss key points from the recently released Lord Darzi report. The National Health Service, NHS, is the collective name for the public healthcare systems in the United Kingdom, including NHS England, NHS Scotland, and NHS Wales. Health and social care in Northern Ireland, often referred to locally as the NHS, was established separately. The systems were launched as part of sweeping social reforms following World War II, with NHS England, Scotland and Wales established in 1948 and NHS Wales, Gig Comrie, in 1969. The NHS was founded with a singular goal: to provide free healthcare at the point of use to all UK citizens, regardless of their financial circumstances. It was created out of the ideal that healthcare should be based on need and not on the ability to pay, making it a revolutionary model for universal healthcare. The NHS encompasses a range of services, including general practice services, hospital care, dental care, mental health services, and public health initiatives. The National Health Service is funded primarily through taxation and serves millions of people each year. It is the seventh largest employer in the world, with more than 1.3 million staff members as depicted on your screen. The idea for the NHS emerged in the aftermath of World War II, when there was widespread recognition of the need for a more coordinated and equitable healthcare system. The Labour government, under Prime Minister Clement Attlee and Minister of Health Aneurin Bevan, spearheaded the creation of the NHS. It was born out of the Beveridge Report of 1942, which laid out plans for widespread social reforms, including healthcare, education, and unemployment benefits. Prior to the NHS, healthcare in the UK was a mix of private, charitable and municipal services, with many people unable to afford basic medical care. Bevan's vision for the NHS faced opposition from parts of the medical establishment, particularly from doctors who feared a loss of autonomy and income. Despite these challenges, Bevan managed to persuade a majority of the medical community to join the NHS, and the service was launched in 1948 to provide comprehensive healthcare free at the point of delivery. Let's examine the NHS budget for 2024. The total budget allocated to the NHS for this year is £179 billion, of which £164.9 billion is designated for NHS England. When adjusted for inflation, this budget remains stable in real terms. In comparison, the overall UK government budget for 2024 is approximately £1.02 trillion, meaning the NHS accounts for roughly 17.5% of total government expenditure. The per-person cost is approximately £2,000 per year. The NHS has marked numerous groundbreaking milestones in UK healthcare. Here are a few key milestones. In 1953, Cambridge scientists James D. Watson and Francis Crick, with Rosalind Franklin's vital contributions, discovered the structure of DNA. In 1956, Frank Parsons performed the first kidney dialysis at Leeds General Infirmary, establishing the UK's first artificial kidney unit. In 1968, Donald Ross conducted the first heart transplant in London. In 1978, the world's first test tube baby, Louise Brown, is born using in vitro fertilization developed by Dr. Patrick Steptoe. In 1979, Roland Levinsky performed the first successful bone marrow transplant on a child. In 1987, Roy Kahn and John Walwork achieved the world's first heart, lung, and liver transplant. In 1988, the NHS introduced the world's first free breast screening for women over 50, leading to a reduction in death from breast cancer. Despite its noble beginnings, the NHS has faced numerous challenges over the decades, particularly in the modern era. These issues stem from a combination of rising demand, financial pressures, staffing shortages, and structural inefficiencies. Some of the major challenges are: the first challenge is related to funding and budget constraints. The NHS is funded through general taxation, and while demand for healthcare services continues to grow, government budgets have often struggled to keep pace. The rising costs of healthcare, driven by advances in medical technology, an ageing population, and increased public expectations, have led to repeated funding shortfalls. Although successive governments have pledged to increase NHS funding, it has often been insufficient to meet growing demands, leading to pressures on resources. The second challenge is with staffing shortages. The NHS has long faced a chronic shortage of healthcare workers, particularly doctors, nurses, and paramedics. In 2023, there were an estimated 110,000 job vacancies in the NHS. Recruitment and retention of staff have become major issues, exacerbated by factors such as Brexit, which led to a decline in EU workers, high levels of burnout, and dissatisfaction with working conditions. Overworked and understaffed teams struggle to deliver care, leading to longer waiting times and growing frustration within the system. The third challenge is how to adequately cater to the ageing population. The UK's ageing population presents a significant challenge for the NHS. Older people generally require more healthcare services, both for chronic conditions and for age-related illnesses. This puts pressure on hospital beds, social care services, and general practice. The system is often overwhelmed by the increasing number of patients needing long-term care, which stretches resources thin. The fourth challenge of the NHS relates to mental health services. Despite progress in addressing the stigma around mental health, services remain underfunded compared to physical health services. Long waiting lists and limited access to specialists have led to calls for more investment in mental health care, with many patients unable to get timely treatment. The fifth challenge of the NHS relates to technology and innovation. While technology presents opportunities for improving care, the NHS has struggled with implementing digital transformation. Many NHS hospitals and trusts still rely on outdated IT systems, and the integration of electronic health records has been slow and fragmented. A lack of investment in modern infrastructure has also made it challenging to harness the potential of new technologies such as artificial intelligence and telemedicine. The fifth challenge of the NHS is with long wait times. One of the most visible signs of strain on the NHS is the long waiting times for appointments, surgeries, and emergency care. Despite various initiatives to reduce waiting times, many patients still face delays, particularly for elective procedures. Ambulance wait times and accident and emergency A&E department overcrowding have become major concerns in recent years. The sixth challenge of the NHS relates to privatization concerns. Privatization as a business model for the NHS is a contentious issue. The NHS primarily operates on public funding, but certain services have been outsourced to private companies, including diagnostics and elective surgeries, which has sparked debate. Conservative governments have advocated for privatization, arguing it can reduce inefficiencies and waiting times by adopting aspects of the American private health insurance model. In contrast, Labour and other critics contend that privatisation could undermine the NHS's core values by making healthcare more of a commodity dependent on individual financial means, rather than a universally accessible service. Healthcare workers, including doctors, nurses and support staff, are integral to the functioning of the NHS, playing a critical role in delivering patient care. Despite their essential contributions, many have voiced increasing concerns regarding working conditions, compensation, and the mounting pressures within the system. Doctors in the NHS are often seen as highly skilled professionals, but they also face immense pressure. Many are dealing with high patient loads, long hours, and administrative burdens, leading to stress and burnout. Junior doctors, in particular, have been vocal about their grievances, leading to several strikes in recent years. Their concerns include pay disputes, working hours, and a lack of career progression opportunities. The British Medical Association, a professional association for doctors in the UK, has raised concerns over the impact of staffing shortages, excessive workloads, and insufficient government investment in the NHS. Many doctors feel that they are being asked to do more with fewer resources, which can compromise patient care. Nurses have similarly faced challenges within the NHS, including understaffing, low pay, and the emotional toll of caring for patients in often difficult circumstances. The Royal College of Nursing, the professional body representing nurses, has repeatedly highlighted the crisis in nursing recruitment and retention, noting that many nurses are leaving the profession due to stress, burnout, and inadequate compensation. In 2022 and 2023, nurses in the UK engaged in strikes and protests demanding better pay and working conditions, which led to heightened public awareness of the struggles they face. Other healthcare workers, including paramedics, midwives, physiotherapists and support staff, also play critical roles in the NHS. However, they too are affected by the same systemic challenges: understaffing, low pay and high levels of stress. Paramedics, for instance, have seen an increase in the number of emergency calls, yet face long delays at A and E departments, preventing them from responding to new emergencies. The NHS has been subject to political influence since its inception, becoming a pivotal issue in British politics. The Labour and Conservative parties have historically presented contrasting visions for the NHS's future. While Labour often emphasises broad access and public funding, the Conservative Party tends to focus on efficiency, fiscal responsibility, and the integration of private sector practices within the NHS framework. This political backdrop shapes the ongoing debate and policies surrounding the management and evolution of the health service. For historical context, it was the Labour government of Prime Minister Attlee that first introduced prescription fees to the NHS in 1951. This led to the resignation of Aneurin Bevan and several other ministers, including Harold Wilson, who was president of the Board of Trade in the Attlee cabinet. Harold Wilson later became Prime Minister of the United Kingdom from 1974 to 1976. The Labour Party has historically been the party most associated with the NHS, having founded it in 1948. The current Prime Minister of the United Kingdom and leader of the Labour Party, Keir Starmer, continues to champion the NHS as a symbol of social justice and equality, emphasising the need for increased public investment to meet growing healthcare demands. In general, Labour governments have strongly advocated for higher NHS funding and opposed privatisation. In recent years, the party has called for more significant investments in staffing, mental health services, and primary care. Labour also favours strengthening the public ownership of the NHS and has criticised the outsourcing of services to private companies. For the Starmer administration, the NHS should remain a publicly funded and publicly delivered service that is free at the point of use. The Conservative Party's approach to managing the NHS emphasises efficiency and fiscal responsibility, often incorporating private sector involvement to complement public services. This has included outsourcing to alleviate pressures on NHS facilities and reduce wait times. Despite pledging to maintain or increase NHS funding, Conservative governments in the UK, including the past administration led by former Prime Minister Rishi Sunak, have faced criticism for underfunding and not adequately addressing staffing and wait time issues. They have defended their record by highlighting the challenges posed by the COVID-19 pandemic and rising healthcare demands, arguing that privatisation and competition can enhance service outcomes without undermining the NHS's fundamental principles. To address some of the key challenges relating to remuneration and to retain staff. In 2024, NHS doctors and nurses will have a pay increase rather than a decline. Doctors and dentists in training will see a 6% increase in pay points, plus a consolidated increase of £1,000, while more senior medical and dental staff are subject to varying uplifts, depending on their contract and band. For nurses, there's an across-the-board pay rise of 5.5%. This rise is higher than previous expectations and is seen as a step towards correcting longer-term pay issues within the NHS. While these increases are positive, they may not entirely keep pace with inflation or fully compensate for the increasing living costs, especially when considering deductions like taxes and national insurance. Thus, while there is a nominal increase, the actual impact on take-home pay may vary, and some may feel that the adjustments do not fully address the financial pressures faced by healthcare workers. The recently released Lord Darzi report in September 2024, that was commissioned by Health Secretary Wes Streeting, critically examines the NHS, highlighting its precarious state and urgent issues requiring attention. Key concerns include long waiting lists, declining national health, and access problems. The report advocates shifting focus from hospital-centric care to more community-based services to meet the rising demands of an ageing population living with chronic conditions. It outlines a 10-year NHS reform plan, emphasising investment in primary care, mental health, and community services for a sustainable system. The report also addresses systemic issues like fund misallocation and poor management, which contribute to inefficiencies and low staff morale. It calls for a reset in the relationship between patients and the NHS to rebuild trust and improve service quality. In response to the report, the Prime Minister Keir Starmer in his speech said, "It's reform or die." The NHS remains one of the most revered institutions in the UK, providing essential healthcare services to millions of people. However, it faces significant challenges from funding shortages and staffing issues to an ageing population and growing demand for mental health services. The perspectives of healthcare workers, from doctors to nurses to support staff, reflect a system under strain, but still dedicated to delivering care to those in need. Politically, the future of the NHS is a key battleground between the Labour and Conservative parties, with each offering different solutions to its problems. While Labour advocates for increased public investment and the preservation of the NHS as a public service, The Conservatives focus on efficiency, innovation, and some degree of private sector involvement. Despite these challenges, the NHS continues to be a cornerstone of British society, representing the enduring ideal of healthcare as a human right, not a privilege. Let us recap. The learning objectives have been met. This concludes our video documentary about all you need to know about the UK National Health Service. Thank you for watching.
If you enjoyed this video, don't forget to like, share, and subscribe. Your support helps us bring more insightful, informative, and educational content to a wider audience. This has been a presentation of Oppo Mulero Media LLC.